Okay, here's the last video going over the midterm. It's questions 25 to 33. These are the scenario related to making a confidence interval, an estimation. A hospital administrator, hoping to improve wait times, decides to estimate the average emergency room waiting time at her hospital. She collects a simple random sample of 64 patients who visited the hospital's emergency room and determines the time in minutes between when they checked into the emergency room until they were first seen by a doctor. The mean wait time among the 64 patients in the sample was 141.5 minutes, with a standard deviation of 47.1 minutes. So the first question is what the population of interest is. So when we're looking at it, we're thinking about what is the hospital administrator particularly interested in. She wants to estimate the average emergency room wait time at her hospital. So, and she's collecting a sample of 64 patients. She's randomly selecting among those who visited her hospital. So keep in mind that the population is always going to be, well, so the sample is a subset of the population. So if the sample is patients, right, then the population must also be patients, but it must be a larger group of patients. And in this case, it would be all patients visiting the emergency room at this hospital. Um, 26 asks, what parameter does the administrator want to estimate? She wants to estimate the average emergency room wait time at her hospital. So the mean emergency room wait time among all of those who visit her hospital, that's in the mean of the population. Keep in mind that the mean of the sample is not the parameter. The parameter describes what's true in the entire population that she's interested in, not just for the sample where she collected data. So this one is a statistic, not a parameter. We want to know what the best estimate is for the parameter. The best estimate is what we're calculating from our sample. So the best estimate is the mean from the sample. And if we wanted to put notation on that, it would be x bar, sample mean. Now we're given a plot of the bootstrap distribution. Remember, bootstrap distribution we simulate when we're making a confidence interval. And the reason that we simulate it is so that we can use it to find the standard error. What does each dot in the bootstrap distribution represent? So each dot in this plot. So keep in mind what we're looking at here, each of these represents a bootstrap statistic calculated from a different bootstrap sample. And the statistic that we're interested in was the sample mean from the bootstrap. So here we're looking at the mean waiting time of a different random sample of 64 patients, same sample size as the original, selected randomly from the population of all people who visited or from the original sample. That's the difference between these two. Right? These are talking about individual patients. Those are wrong because each one's representing the sample mean from a bootstrap. And when we do a bootstrap sample, we're not taking a different sample from the population. The whole point of the bootstrap method is to be able to estimate the standard error from the data in just one sample. So with the bootstrap, we're resampling with replacement from the original sample. So the answer here is D. We want to know what the standard error is of the best estimate. The standard error comes off the big center plot in the bootstrap distribution. So it's 5.9 minutes. Whenever we want to find a 95% margin of error, the margin of error is 2 times the standard error. So 2 times 5.9 gives us 11.8. That would be our margin of error. To give the upper and lower limits of the confidence interval, we're going to take our best estimate plus or minus our margin of error. Our best estimate was the mean from the original sample, 141.5 minutes. Our margin of error we just calculated by taking 2 times the standard error, and we found that to be 11.8. So now if I do a little quick math here, 141.5 minus 11.8 gives me a lower limit of 129.7 minutes and an upper limit, 141.5 plus 11.8 of 153.3 minutes. And there's my 95% confidence interval. Question 32 asks if it's valid to generalize the results of this research. So remember that when we're trying to decide if we can generalize the results, what we're looking for is, did we use a random sample? If we did, then we can generalize to the population that the random sample was selected from. So going back and looking at our scenario, she collects a simple random sample of 64 patients who visited the hospital's emergency room. So the answer should be yes. Since the study used a random sample, the results can be generalized to all patients visiting the emergency room of this hospital. Okay? And then we want to look at a correct interpretation of the confidence interval. Remember that the confidence interval is always an interval that we're confident will include the true value of the parameter that we're estimating. In this case, the parameter that we're estimating is the mean emergency room visit among all patients who visit this emergency room. So I'm 95% confident that if I randomly select, that sounds not what I'm looking for. I'm 95% confident the average wait time for the 64 patients in the sample. That's my sample statistic. It's my best estimate. It's not my parameter. So this one is not what I'm 95% confident about. I'm 95% confident the average wait time among all patients who visit this hospital's emergency room is contained in the confidence interval. That is the parameter I'm interested in. So this looks like the correct answer. Reading the last one, I'm 95% confident that if I take a random sample of 64 patients who visit this hospital's emergency room, the sample mean will be contained in the confidence interval. That is not true. And I'm 95% confident, just back to the last one again, first one again, I'm 95% confident if I randomly select a patient who visits the emergency room, their wait time will be contained in the interval. And this one's wrong because we're not talking about the mean of the population among all patients. We're just looking at one individual patient. So that one's definitely wrong. So back to this one. There's our correct answer. So hopefully you found these videos helpful to kind of go through the old exam, make sure that you understand. I tried to really talk through a lot of the possible choices, even the wrong ones, to give you a sense of what was wrong with them. But if you find you have any questions, please let me know.